Tina Drago with Healthy Las Vegas, coming to you from Studio A at the Beasley Broadcast Station. Today, I am fortunate to have Ray Simpson, Chief Nursing Officer with Monte Vista Hospital and Red Rock Behavioral Hospital. And along with her is Sharday Edwards, who's also the community liaison for Monte Vista Hospital and Red Rock Behavioral Hospital. We're going to talk today about mental illness and prescription substance abuse. So let's just jump right in there, Ray. How you doing?
I'm great. Thank you. Thanks for having us.
So how long have you been with these hospitals?
Well, that's a great question. I've actually been a psychiatric nurse for over 20 years, but I just joined Monte Vista and Red Rock in December. So I'm brand new to Las Vegas, and I'm loving it.
Welcome to Las Vegas. You're going to love the heat this summer. Oh, my gosh. And Sharday, tell us about you.
So I've been with Monte Vista and Red Rock Behavioral Health Hospital for a year yesterday. So I'm super excited. I love the behavioral health industry.
A lot of people out there with needs.
A lot of people. Mm-hmm.
Well, we're going to jump right in. What does the meaning of mental health? What does mental health actually mean? I mean, people tell me I'm crazy all the time. Mm-hmm. Is that like certifiable? What does it mean? How can we tell?
Well, I think there's two things. Mental health means that it's just who we are. It's our mental health. It's like we're physically healthy, we're mentally healthy. It means we're functioning normally day to day. When we have a mental illness, is similar to having a physical illness. There's something different. There's something wrong. And so actually, it's quite common. 1 in 17 Americans actually suffer from some type of mental illness that ranges from anywhere from a mild depression to maybe some anxiety, social phobia, to something serious as serious as bipolar, which is a manic type depression with depression, or schizophrenia. And so there's quite a wide range. Some people have what we call situational depression, where you're actually doing very, very well. You're highly functioning. You're going to work. You're doing your normal day-to-day operations, but something in your life has become a crisis for you.
A trigger?
A trigger. You know, it can be a major loss in your life. And you just can't, your normal coping mechanisms don't work anymore, and you start to crumble, and your normal day-to-day stuff starts to fall apart, and you end up seeking help. And it's a situational. Once that situation is fixed, maybe you get a new job, maybe the new baby grows up, and you're back on track and everything is fine, and you never ever have any problems with it again.
See, I grew up in that generation where my mom says, like, suck it up.
Yep.
Mm-hmm. Get over it, deal with it. You know, we all have hardships in life.
Exactly.
Right.
Function. And I mean, I would say anybody probably below the age of, or over the age of 50, probably had that same type of upbringing, you know? Now it just seems that everybody gets coddled. Everybody gets to be put in a little, there's a reason why their behavior is, and we should accept that reason why. Sure. And now we're really fragmented. I'm thinking more like the education system,
right.
As an employer.
Well, you know, it's kind of interesting. It's like the buzzword.
Yeah. Mm-hmm.
It's like, oh, everybody has ADHD.
That was going on in the 80s and 90s.
It's like now all of a sudden we have adults with ADHD. Mm-hmm. And so it's like the buzzword. It's the big thing.
Or could it be just an adult who just doesn't have control over themselves?
Right. And you know, unfortunately.
Discipline, man.
Yeah. Well, you know, and you mentioned that get over it, toughen up. Mm-hmm. You'll still hear that.
Absolutely.
Mental illness has got a huge stigma, and it really is about getting out and educating people. Mm-hmm. Mental illness is just like if you were given a diagnosis of diabetes. Mm-hmm. You don't hide that. You tell people about it. You want to educate people about it. What can you do? You know, for diabetes, you would change your diet. You would exercise. You would get more rest. Well, you know what? You can do the same thing for your mental illness. For mental health, we need to be eating right. We need to be exercising. We need to be finding coping mechanisms. Mm-hmm. The other thing that's different, I think, now is that substance abuse is more and more prevalent. And a large portion of our patients or our community members that are suffering from mental illness are also substance abusers because they're treating their symptoms with drugs or alcohol.
Is it prescription? Is it street?
It could be
anything they can get a hold of?
Yeah, anything. And there's some states now. I'm from Washington, and we just passed that lovely law that marijuana is okay, and so now people are going to be self-medicating with marijuana. It's an addictive drug as well.
So let's break it down. I literally had a open house over the weekend, and I had 6 couples there. Mm-hmm. We had one couple. One of the ladies, this is grandma, okay? Mm-hmm. You know, this is like the Summerlin sweetie I was telling you about, who was given a drug for back pain. Mm-hmm. Somebody read about it, and she actually got herself off of it. And to be honest, I forgot what it was. But it wasn't safe for her to get herself off of it. She went cold turkey. She's like, I can't believe this is killing me, and I've been taking this for so long, and my doctor didn't say anything.
Right.
And we see a lot of that in, I don't want to say the more affluent, but middle class. The middle class, the people that go to work.
People that have insurance.
People that have insurance. Thank you. That's a
People that have insurance.
Yeah.
They're the people who are getting these prescriptions, and then they look up one day. I have a neighbor who's a police officer who got injured on the job, and he actually was on pain medication, oxys, for 8 years.
Right.
Wow.
And had to detox off of it.
Yep.
He's at work.
Right.
He's carrying a gun.
Yeah, and
and he's on these pain drugs. And this was in the late 90s, but it's more prevalent than I think people want to talk about.
Well, part of that goes back, if you go back a few years, it used to be that the doctor judged your pain level. And then there was a huge push, patients have rights. And pain is a subjective. So if I tell you I'm having a pain of 10 out of 10, then as the physician must listen to that patient. And so the physicians were being pushed to meet that patient's needs. And so what was happening is they were just writing scripts. And unfortunately, I have a personal example. I hurt my shoulder. I went to the doctor and I said, I want to make sure it's not injured. So we did some x-rays, nothing there. So we did a cortisone shot, loosened it up a little bit, but still I was having a hard time sleeping. So he writes me a script for a muscle relaxant and a pain medication. And I'm like, okay, sounds great. And I leave. I don't even look at the script because we talked about it. I get to the pharmacy and I give him the script, and it's for 100 tabs, 100 tablets of an oxy, a narcotic, and 100.
That's a month's supply.
100 tabs of the muscle relaxant.
Wow.
I told the pharmacist that I don't want 100 tabs. Please, can I just get I just need 3 days. I just want to get through the weekend. I want to be able to sleep so I can go back to work on Monday. And the pharmacist said, I cannot give you less than what the physician has ordered. The physician wrote 100. I am required by law to give you 100.
I do that all the time, though. I go. My husband this is the point of contention. He had an implant put in. The doctor gave him 2 weeks of pain meds.
Yeah.
I went to the pharmacist and I said, I want 5 tablets.
Yeah.
And she laughed at me and I said, no, don't give me any more.
Yeah.
Otherwise I'm going to take them and give them right back. You want a bill?
Yeah.
Bill.
Right.
But I only want 5 in that little jar.
Yeah. Yeah. And there are people that don't take them, but then they don't know what to do with them. So now they have they have bottles of 100 tablets sitting in their medicine cabinet. Someone comes over to visit and they start snooping in their bathroom and they find these bottles of scripts. They take out a few, or grandma has them in her purse from the last time she went to the doctor.
Or you have teenage kids.
Teenage kids are going through.
A big problem with Skittle parties.
Well, and you know what, or farm parties.
Yeah.
So, okay, what a farm party is and a Skittle party for our listeners that don't know is everybody that comes grabs something out of the medicine cabinet.
Anything.
And puts it, I mean, you could have birth control.
Yeah.
You could have oxy. You could
or
have
heart hypertension medications.
You could have anything. You throw it into a bowl. They mix it up.
And you take a handful.
Yep.
And kids are dying because...
It's happening everywhere.
Everywhere. And they go to the emergency department, and the emergency department's saying, well, what did you take? And the kids have no idea.
Nope.
And they're dying. I mean, they're
pink one, a blue one, a little white one.
Yeah. They have no clue what they're doing to themselves. So it's scary. But it's
you have to safeguard.
Yeah,
I would say parents, if you have prescriptions that are unused in your medicine cabinet, you can always take them down to the police station. There's a dump container there that you can put your pills in. Or... you lock them up. If you're one of these people that says, you know what, I don't want to get rid of them because I may hurt myself 3 years from now and try it out, even though it'll be out of date.
Yeah.
But lock it up. Think of these prescriptions like a gun.
Exactly.
Because they're just as lethal.
And they're also worth a lot of money on the streets.
They are.
Yeah.
Unfortunately.
I actually saw a billboard driving here, and it says, don't be your child's dealer.
Yes.
And I was like, wow, that's really powerful, because it is. You could be your child's dealer by going in the medicine cabinet and putting their bag and having these Skittle or farm parties. So.
And you don't know. And And they go for a lot of money,
They
these
do.
drugs.
They do.
As running a primary care clinic, when we have people come in and we know if they're working with a pain management doctor or they're on any anti-anxiety medicine, we ask them to always do a urine test because we want to make sure they're actually taking the drugs that are prescribed to them and they're not selling them because that will completely affect how our providers will deal with them as far as what we prescribe for them. So because there's a lot of drug conflicts and stuff. So it's important to take what's prescribed in small doses and only when you need it and then dispose of it properly.
Exactly. Yeah.
So, wow, we could go on a whole lot on that. Okay, so let's get back to mental illness.
Yes.
Because this is really your wheelhouse, isn't it?
Yes, it is.
So mental health can be good or it can be bad. It's what we all have mental health. Mental illness can be from slight depression to something that's triggered. You know, we always say life cycle events when we're looking at patients. Did you get married? Did you have a child? Was there a death in the family? Did you get a new job? Did you move houses? These are all stress markers.
Right.
And it's important for our providers to know this because whether they're good or bad, that level of stress is still real and it's real on the body. So you can have something as, as simple as that, which we all deal with at some time because we all deal with life cycle events, to something that's more serious. And you see like you're saying, the bipolar or schizophrenic. So tell me how you would consider or how you would know the difference between one to the other. Where do you recognize serious mental health? What's the process?
Well, part of it is really just assessing that individual, talking to them, asking lots of questions, looking at their history. Have they had previous situations? Is there a genetic link? Is there anybody in their family that has suffered from depression or schizophrenia? So really doing a very, very thorough assessment, asking lots of questions. Sometimes you can refer them to depending on how severe the symptoms are, they can do a self-help group. They can start going to support groups, talking to other people that are going through a similar life change. Maybe they've been diagnosed with cancer, and that it's helpful to talk to other people in the similar situation. If they're having more severe symptoms, such as it's really changing their daily living, they can't go to school, they can't go to work, they're either not sleeping or they're sleeping too much, they're either not eating or eating too much. It's usually one extreme or the other.
And let's clarify. There are times when it's appropriate for us to be depressed.
Oh, absolutely.
If you're not, we have to worry.
Right.
Like the death of a family or a loss of a job or things like that.
Yeah.
There are reasons for us to go through that emotion. But if that depression is triggered from a commercial or a movie or
and
a
it also
thought.
is a length of time. It's like if you've suffered a major life situation, it may take you a few weeks to get over that. But if we're talking about this is going on to 6, 8 weeks, 3 months, 6 months, and you're still having those feelings of despair, loneliness, you may actually having actual suicide ideations, which means you're thinking about what it would be like if you died or if you killed yourself. You say things to yourself that, life would be better if I wasn't here. My family wouldn't be burdened if I was gone. And when you start thinking like that, that's when there needs to be somewhere you need to say, I need to talk to somebody. And even if you only talk to your best friend or you talk to a loved one and say, I'm having these feelings, then they can help and then hopefully get you to a mental health professional. It can be just a therapist. It could be your pastor or minister at your church. Could be a counselor. You look through, now we Google everything, but get online and see if there's a local counselor. You can call, if you have insurance, call your insurance company and say, who can I see that I can talk to about how I'm feeling?
Let's talk about counselors. There's a difference between a psychiatrist and a psychologist.
Absolutely.
And it's more than just being able to prescribe drugs.
Correct.
They're both doctors, but you really need to look into what would be better for you. In counseling situations like depression or life cycle events or triggers, maybe a psychologist will do a deeper dive into your therapy, will really get you to start doing some cognitive behavior work, changing the way we're thinking. And then you can also go, sometimes it depends on the life crisis. It could be maybe even a marriage family therapist that you would go to, a social worker you would go to. And then the psychiatrist truly is a physician that you go to see that's going to run some tests, might do some lab work, and then get you on the right medications. And they're the ones that determine that physically physically you are not going to be able to
Right.
get over this mental illness
Right.
and you need assistance.
Right. Right.
But if it's something that's in your head or in your heart, that's something that we can work through too. That's a growing process and a learning.
And many times, the patient's going to need both. They're going to need that therapist. It's really going to help them re-channel how they're thinking, and they're going to need that medication to get them on board. And sometimes they have to be on it for the rest of their lives. And sometimes it's within, 6 months to a year, the life changes are happening. They get those neurotransmitters, that norepinephrine and the dopamine and the serotonin in their brain, those chemicals that alter our moods. We get them on the right medication, get the brain working again, and everything's starting to trigger back, and they can get back on track, and they don't need to take the medications anymore. But there's such as many varieties of people we have out there, there's just as many variety of treatment options. I mean, even so much as I've actually had patients that have been so severely depressed, they've curled up in a fetal position and wanted to die. They've stopped eating, drinking, talking, and we've done everything possible. We've actually gone to an ECT, the electric convulsive therapy, and within 1 or 2 treatments, the person is up, walking, talking, eating, and within 3 or 4 treatments, they're actually no more depression symptoms, and they're back home living with their family and working.
Is that literally just snapping them out of it?
It's almost like recharging the brain so those synapses are meeting again, and those transmitters are connecting again. And when we talk about shock therapy, I'm sure everybody immediately thinks of the one, what is it?
They were threatening me with the dog collar.
Yeah. But I'm thinking that the One Flew Over the Cuckoo's Nest,
exactly.
the worst, scary, horrible psychiatric movie you can imagine.
Frankenstein,
it's not that anymore. It's
No, not
very,
at all.
very.
Think of it as a strong biofeedback.
Really, and we actually have ECT at Monte Vista. We
The
have
only one in Nevada.
Yeah, and our physicians are certified and trained to do it. We have our nurses that are certified and trained to do it, and it is truly a surgical procedure. And we go through and we manage the symptoms. We make sure that patient is safe, and we're seeing some miracles happen every day. It's pretty
That's
neat.
phenomenal.
Yeah.
I mean, I always love the success stories.
Yeah.
And before we end, I'm going to ask you to give me one, like an
Okay.
example of the average person that could be our neighbor.
Yeah.
I know I have a dear friend who is manic depressive. I mean, up on top of the world.
Yep.
Everybody loves her. She walks into the room, lights the place up,
Yeah.
and then I don't see her for a few days.
Yeah.
And I'm like, what is going on with you? You go hide on me like that? What's going on?
Yeah.
And literally, we've been friends 7-8 years, and it wasn't until a couple years ago that she confided in me.
Oh, wow.
She's like, there are days when I just can't get out of bed. And I'm like, what are you talking about?
Yeah.
It's like,
Yeah.
And she's like, yeah. And I'm like, but you're always so happy. And she goes, and then I have to come back down. And the pendulum swings. And
Wow.
and so, and it's funny because it's genetic in her family.
Yeah, absolutely.
Oh, okay. Yep.
And so, and it was the grandma and the mom and her, and I'm like, okay, so let's think of ways, and she's Miss Healthy, something healthy to eat, exercise. But I can see that she's trying to do the best she can do, and she realizes it. And now, as her friend, when she just flakes off, I don't get upset. I'm like, okay, she'll be back.
Right.
She's a recharge.
Just leave the door open, and
Yeah.
when she's ready, she'll just swing right back around.
Exactly.
But it's a recharge, and it's. At first, I was kind of like sad because I thought, well, what can I do? Because
Yeah.
being Miss A personality and enabler, I immediately want to wrap your arms around them
Yeah.
and make it all better.
Yeah.
But
But you
sometimes you
can't.
just have to allow them to do what they do, right?
Yep.
And you've actually done what everybody needs to do is just get educated.
Yeah.
Ask the right questions, understand the disorder, and ask the person that's struggling with a mental illness, what can I do for you? And they'll tell you. They'll say, well, I just need to be left alone.
Yeah.
Or I need you to check on me on a regular basis, or I need you to remind me not to spend that extra money when we go on our retail therapy shopping trips.
yeah.
But it's almost like developing a treatment plan with your friends and family.
Absolutely.
That immediate gratification is also a mental
Oh,
illness.
absolutely. Yeah.
Can you expand upon that a little? Because there are people that go crazy and have to buy their, it's I don't want to say they're hoarders because it's not on that level.
Yeah.
But it is almost that trigger that they feel gratified, they feel good about themselves, they feel empowered, they have all these positive feelings from buying something that's really of no use. They don't need it.
Yeah.
And it goes back to those neurotransmitters, that norepinephrine and that dopamine. It's kind of funny when you say that, because it's like, people that someday I want to be a jogger. I want to be one of those runners. Everybody says, you got to keep running until you get that runner's high, and you're going to keep running. I'm like, well, I can't get past this. My side hurts and I'm tired. But
right here,
I'm like, but it's that whole thing. If you're a jogger and you've ever had that runner's high where that dopamine kicks in and your norepinephrine and your serotonin, and you're feeling great and fantastic and wild, and I can go another 3 miles. That's the exact same effect that you get if you're manic and if you're addicted. It's that addictive almost personality where that immediate gratification, whether it's whether you're doing a line of cocaine or whether you're out shopping, there's sex addicts, there's gambling addicts. I mean,
but it's all controlled in the same
it's
area.
It's the exact
of the brain, right?
same part of the brain. There's actually been research showing CAT scans of all the different patients that are suffering from the different addictions, and the exact same part of the brain is triggered in each and every one of them. It's fascinating.
So my kids say, like, I'm a workaholic.
You're probably,
and that's where I get my high. I get my high like doing
I'm with
business.
you.
Well, and
me too. Yeah.
And the new things we're seeing are the immediate gratification with texting, IMing, and the video, and the social media. Especially our kids are so connected to social media, to the electronic devices, that we're seeing. It'll be interesting to see where they end up in the next 10 to 20 years, because that's impacting their lives right here and right now.
It's even like the number of likes you get on Facebook or social media.
Oh my gosh.
Yeah.
I'm that person.
Yeah.
Okay, so I only do it once a year, but I count how many happy birthday wishes I get.
Oh.
No, you do sometimes. You kind of compare. Well, last year I got 180. Now I got 105.
Like, yeah,
who doesn't love me
off?
this year? Who did I miss this year? Or even like when you're on. I know some people mention, I'm taking my photo down on Instagram. I got less than 20 likes. I'm like, are you serious? Like, is that the purpose of you posting? So the same concept.
Yep.
You know what? But I'm that person when they go, is anybody listening to me out there? You won't be my friend unless you. I'm like, get over yourself.
Yeah.
I'm busy.
Yeah.
Yeah. But social media is huge.
Yes.
It really is, and it's out there. And of course, this show goes up on my Facebook page.
And you want likes.
We want many likes.
Likes. I want shares. I want to see how many views. You
want to go viral, right?
Exactly.
Totally want to go viral. I told them if they put a camera in this studio and could watch us in here goofing around while we're talking, it would go viral.
Because we're just goofy, right?
Yeah. Well, you have to enjoy yourself. You're talking into these funny-looking microphones, so it is all. It's all good in that area. Tell me something about. I'm looking at my list of questions here. Give me some warning signs. Different from, okay, I'm not feeling well, or I'm down, or ups and downs. When should someone be like, well, this, I had to be serious about this.
Yeah.
This isn't positive behavior, or because we all kind of are in our own little worlds. When it comes to ourselves and the people around us, and unless you're like in our most inner circle, are we that focused on warning signs?
Right.
So, what do you look for from, I have a neighbor that runs down the street naked every so often.
Oh, wow.
That could just be norm, though.
That could, yeah.
It's definitely a warning sign. But, for me, hey, whatever it takes to make you happy.
Right?
I think in most cases it's the extremes, because, when you look at the symptoms, the signs, the warnings, you think about it, like the first one is difficulty concentrating, remembering details, and making decisions. Well, every one of us has had that.
Right.
You're just overwhelmed in the day.
That's called Monday.
Yeah, exactly. Fatigue, decreased energy. Now, when it gets to the point where you're so tired and you just can't do anything, that's like, okay, there's something wrong with me. And then what I would say is go to your primary care physician and say, I'm not feeling right. I'm off my game, because maybe there's something physically wrong. Maybe you have an infection you don't know about. Maybe your blood work is a little bit off. Maybe your thyroid level's down. So it's really good to go to your primary, get a physical, and say, is this physical or is this mental?
Yeah.
Feelings of guilt, worthlessness, helplessness, feelings of hopelessness, insomnia. Either you can't fall asleep, or you fall asleep and you wake up and you stay up and you can't get back to sleep. You're irritable, you're restless, loss of interest in activities, loss of pleasure in life, overeating or appetite loss. So you've got the two extremes again. Persistent aches and pains, you just don't feel right. cramping, headaches. You just, and the doctor says there's nothing wrong, but yet you still know there's just something not there.
Don't you hate it when the doctor says there's nothing wrong, but you feel like there's
you,
something
you
wrong?
know there's something wrong, and you got to follow it. I always tell
do.
people, follow your gut.
Exactly.
If something's telling you something's wrong, keep asking questions.
Yeah.
And if that doctor's not listening, you find another doctor.
Absolutely.
But you can also ask the doctor to run some tests on you.
Absolutely.
Run labs, run tests.
You've got to be your own patient advocate.
Yeah. You
do.
And if you don't have a strong enough voice, take somebody with you that can speak up for you.
So do you have a support group at Monte Vista and Red Rock? Do you have, if somebody calls in and goes, I have all those symptoms you just talked about.
Well, we have a couple things.
Who can I talk to?
One of the things we always recommend people to call, we've got what we call our A&R team.
And what number would that be?
702-364-1111.
Say it again for me.
702-364-1111.
Excellent.
And that team will take your information and they will refer you whether to be a support group. They might encourage you to come in so we can meet with you one-to-one. Depending on what your situation is, they'll make some recommendations. But they are definitely the one-stop phone call that can help you link to your community resources.
And Sharday, you're out in the community, so you have a ton of resources.
I do. So if you guys ever need help, my name is Sharday Edwards, and I can be reached at 702-635-1086. Once again, that's 702-635-1086. And I'd love to help you.
I'm going to put all their information on the YouTube video and the emails and the phone numbers. So if anybody doesn't have a pen to write this down, go to YouTube and check out Healthy Las Vegas. And you'll be able to pull up the show and listen to this all over again and all this wealth of information. This is Tina Drago with Healthy Las Vegas, sponsored by First Person Care Clinic, coming to you from the Beasley Broadcast Studio A. Thank you.